Okay, so for the second major section of the day, our objective is to tackle in a roundtable discussion from the perspective of each of the labs that have been engaging today. We'd like to tackle various issues that are also hovering within the civic sphere. As Maria Pia has already mentioned and anticipated, we are working on identifying and defining specific problems to address this in the city of Madrid. But we were also very interested in hearing your perspective and prior experience. It's true that in the interventions that you've carried out, the various labs have mentioned several projects and experiences that are somewhat aligned with the issues we wanted to tackle, which are twofold. On the one hand, the aging population, and on the other, youth groups in disadvantaged neighborhoods. So let's begin with the first issue, which is our aging population. I'd say this is a structural problem throughout Spanish society, and it has already reached further levels in the West, so to speak. And here we would like to ask the various speakers about your understanding of this problem, that the aging of the population might represent a challenge. In what ways do you think it represents a challenge in the environments in which you operate and work? Also, taking advantage of the fact that, and in every intervention, you can let us know whether you've already addressed this issue, which we've seen on many occasions you have from your hubs or labs, or what strategies you think might be useful to address this. Likewise, if you'd like to highlight any projects you haven't mentioned yet or highlight others that you've already talked about, initiatives or maybe projects that you've launched or think could be launched to improve the living standards of our senior citizens or to encourage participation at community level, we'd appreciate your response. For now, we're going to leave the floor open for discussion. So why don't we start with any of the labs? If not, we can organize your presentations. I don't know if, for instance, the HIS you've mentioned, the latest SALSA project, which I think was also related to this topic. If you want to start, maybe? Okay. We can think about our challenges. Of course, there are many. But I think mainly in two aspects. On the one hand, it's a challenge for the system, the demographic increase of the population, which will increase by so many times, with the number of people over 65 set to double or triple in the coming years. Obviously, this increase in the aging of our population is putting a strain on us, obviously, and therefore the services currently offered will not be sufficient to cover this population, both from a health and social perspective. Therefore, it seems to me to be an utterly important challenge. On the other hand, we need to consider how at system level, how can we continue to maintain these services, whether healthcare or social, to help promote a healthy aging and provide the necessary coverage. And on the other hand, there's how can we raise awareness among the population that aging doesn't always have to mean problems and more intensive social services and dependency, but rather that we need to work on, from my point of view as a CEO, we need to raise awareness among this population so that they take that joint responsibility with us for their health and the care they need to promote an autonomous and healthy aging, healthy habits, as we have seen in the SALSA project, whether that is nutrition, but also physical activity, leisure, which in the end are all interrelated, and we see that these are social determinants that have a very significant impact on health, as we've been able to see in the SALSA project. If you eat healthy, you create a network of contacts as a result of this project, and you improve your depression or anxiety, to say the least. You improve your living standards. I think the two biggest challenges for me would be seeing how the system can be de-stressed. I think everyone is aware of this, and we need to define strategies to relieve some pressure from the system. And then on the other hand, that co-responsibility and self-responsibility by our seniors in terms of their care, health, as people age. If you will, at the HIS, we've generated 2 calls to combat these 2 major participatory challenges that we have defined. Unwanted loneliness, we've seen it in the SALSA project. There are others in which you say by acting at this level, trying to improve that feeling of loneliness, we can gain a lot. We have less impact on health and social services because people are less dependent. There are fewer hospital visits, hospital appointments, and so we are putting emphasis on that and defining a way forward. Also in the second call, specifically community alternatives to institutionalization. This is precisely about promoting projects to avoid, and I had explained to you that we started from the point of view of de-institutionalization because the system won't be able to support this if we transform it with participation from a participatory consensus and defining this challenge into community alternatives. And this is super important, this promotion of community alternatives that allow people who live in their homes to be able to help other adults stay at home. Many of the projects we are incubating provide this support at community level. We have a university project, precisely the University of Nursing and Occupational Therapy of Catalonia, which introduces 2 types of profiles into the care of elderly people in the community. One is the profile of an occupational therapist who helps adapt the home to make their life easier and avoid potential risks, and then a person that they define as a personal assistant. This person allows someone who lives on the 5th floor, who has to go down to the street, who has no elevator. Also, it's summer, they're alone, they don't know if they can go out, they cannot come back up. This personal assistant will make sure that this person can go to their social center, to the neighborhood social center, carry out activities, have relationships, increase their social engagement, and feel better thanks to this accompaniment. So I believe that the 2 calls we've made, without being specifically designed around population aging, perfectly address how we can tackle this issue. And I think these projects, the idea of conducting these proofs of concept, which are so short and quick, are very interesting in terms of asking ourselves, is it useful or not? Do they add value? If they do, we need to replicate them. And this is the great challenge we are facing in the system. How do we provide financial continuity for these projects to keep going on? There's another project, Cronisol, which also involves people going on community nature walks with workshops that are dynamic and ultimately generate a network of contacts and improve the living standards and measurable health values. I believe this would be a bit of our vision. Yes, thank you very much. Other labs, for example, LAAAB, have also mentioned projects aimed at people who are over 65. I don't know if you have anything to say there. How do you plan to address this challenge in your autonomous community? Well, you might know that Aragon has a very high aging population rate. We need to think about a perspective of aging actively, which I think we often neglect or forget, and we place older people in these restricted categories in one-way perspectives, and the collective of seniors is very diverse, even now intercultural, and with all kinds of derivatives. Another interesting perspective for me is the rights approach or rights perspective. Here in Aragon, one of the participatory processes is about to start at the end of May. It is the participatory process for a comprehensive law on the rights of older persons, which is pioneering or semi-pioneering in Spain, and which attempts to bring together this perspective that often eludes us, the consideration of older persons as full citizens and with their own peculiarities and characteristics. It's very much in line with combating ageism, which in this society and in recent years seems to us to be a very serious issue. In addition to the loss due to this discriminatory perspective of the potential and value that older people have in this sense too, another major challenge is the integration of systems, the integration of public policies. The example of Catalonia is fantastic because it attempts to harmonize through specific projects realities that remain in no man's land. And so to speak, they represent a shared responsibility. And then from here, we care a lot about the issue of participation, giving voice to others, ensuring that participation is realistic, real, not manipulated or directed. In this sense, the Senior Lab, which we have already shared with you, and that is going to be designed this year, is part of a line of action that we've approved for the OGP plan during this period. The issue is working with older people, or the main topic. It's very important, it's essential to listen to all voices from an open and interpretive perspective, because we are all involved in the issue of aging in one way or another. Here in Aragon, one of the key elements we must bear in mind is the rural-urban divide. People aging in rural areas, sadly, carry the burden of the shortcomings of those regions, very small, heavily aged towns and villages with difficulties in accessibility, transport, and services, which inevitably influence everything else. In this sense, another of our priority lines within the Senior Lab for this period with the OGP is decentralization and working with rural communities, and of course, older people must be a part of that. As for the digital sphere, this is key. The project is delivering fantastic results, and it's essential to shift older people out of the role of mere service users. I believe we need to start dismantling that perception, thinking of them not just as users of benefit services or meal programs, but as active participants. That would be the key idea. Jesus, thank you very much. The truth is there are many different realities in each territory, in each field of action, each lab. If you agree, from Comillas Living Lab, Bernardo, perhaps you can share your vision on this major challenge and potential solutions, or tell me if you've already addressed it. Yes, sure. Specifically from the Living Lab, we haven't tackled this particular topic yet, but it's definitely very present for us. In fact, I also collaborate with the Office for Innovation and Teaching Support here at Comillas, and there are many service learning projects. I mentioned it earlier at a certain point, and precisely what we are managing to do is to create impactful projects that connect what's happening in the classroom with some partners or institutions with whom we co-develop the project. This has led to some beautiful initiatives. Every year a call is launched, and some of these initiatives are awarded within the university. For example, from the Department of Nursing and Physiotherapy, I know there has been special attention on the topic of aging. So there was a program aimed at giving physiotherapy students the opportunity to work directly with older adults, putting into practice things like stretching, nature walks, and similar activities. The Department of Education has also launched similar efforts, initiatives, and projects, but of course, as we are still in the early stages at the Living Lab, we will surely begin to engage more actively with this issue as we move forward. Thank you very much, Bernardo. Diana, from NovaGob, in this regard, have you worked along these lines? Are you planning to address it? Have you reflected on it? Can you hear me? Hello? Yes, we can hear you very clearly. Great, good morning, and thank you very much. Sorry to take 10 seconds to thank you for the participation and the initiative, but it's very important because this space is a fantastic platform to share. We are seeing that from the different labs, there are many initiatives emerging to engage with various communities. As we've mentioned before, and the director also pointed out, we are not currently focused on this specific area of work with older people, but what I do want to highlight is the importance of the methodology and giving attention and space to different groups. We are seeing fantastic initiatives here, like Salsa or the Senior Lab. In the end, what matters is giving people a voice. That direct participation should be meaningful and have an influence. Obviously, we hope to incorporate these collectives into the various projects we will be developing. So I wanted to keep it brief because I know we're running a bit short on time, and I may expand a bit more in the next round. Great, Diana, thank you very much for your contribution. And finally, Maria Pia from THIVIC. Well, thank you very much. In fact, as was mentioned earlier, this is one of the major themes identified in our lab. We don't do anything without intention. I mean, we brought up this topic just because we want to learn from others, not just for the sake of it. I think it's essential to understand how others are approaching it. Why did we focus on Madrid? Because it's kind of the socio-demographic profile of Madrid. By 2030, the population over 65 will represent 23%. That's 3 percentage points more than 10 years ago, in just a decade. Rather than a problem, and you've said this, Aragon is especially familiar to me, it's the reality that we have to face, and with a positive approach, we have to normalize it and implement active, healthy, aging measures. In the end, we're all going to end up old, that's clear. We don't have to wait to improve our city or neglect it until this happens. And Aragon also said this, so we talked about categories. We can't put the elderly in a caboose. In the end, they have to be spread out along the entire train in different carriages, and we have to make them an active part of life. In Madrid, this isn't a new problem. It's a well-developed issue. There's an age-friendly city strategy that addresses them from a very broad perspective. You've also mentioned it, and that's the bad thing about speaking last, which is that I'm repeating myself a bit. It's approached from a civic perspective, participation, live volunteering, intergenerational activities, employment in the healthcare setting. Catalonia mentioned it, social services, prevention, comprehensive care. We also have a very powerful program to address unwanted loneliness among the elderly, and then the urban environment. In short, a global strategy that isn't, it's a living thing. We must continue to nurture it, and I think that if we can work on it, I don't know how long it will take us to work on it at Civic, but it's certainly a challenge. Thank you very much for sharing your ideas. Well, thank you very much, Maria Pia. I forgot to mention something. that I also think is very important in this matter. I didn't mention it in my presentation because we have it here in Aragon more closely linked to transparency, but the issue of access to information is crucial, especially because we have a project launched with Plena Inclusión with works on the whole issue of easy reading and easy language. When these students work each month on a bunch of regulations, how to interpret an electricity bill, how to understand the list of rights in social and healthcare services, etc. They not only simplify and clarify things for people with all kinds of disabilities or diversities, but especially for many older adults. And the issue of equal access to information also involves ensuring that the administration and all its bodies are user-friendly in this sense, but user-friendly in practice too. The fact that you can easily understand everything, because if not, we are going in the wrong direction. We are starting to work on differentiated levels that don't help. This is what I wanted to tell you about as well. Thank you very much, Jesus. Let's move on to the next issue that we wish to tackle, which is youth groups in disadvantaged neighborhoods. This is also quite multidimensional, how it can be attacked and addressed. In this case, if you'd like to share with us any formula or something you consider has been successful in addressing this matter, or maybe if you plan to do so with any specific formula, if you are still reflecting on it. In this case, I think that Jesus, you said it, it's true that in Aragon, you've highlighted that there was a Social Impact Academy project that already addressed the issue of social entrepreneurship among young people. I don't know if you've also thought about groups in disadvantaged neighborhoods. In principle, the projects are open. The calls are open to any kind of participant from the youth collective. Of course, when we carry out the social academy and any other project where we disseminate or intensify our information the most is through those established associative networks that have been working for decades. As Maria Pia said before, labs have limited capabilities. How can I say this? We can't address hyper complex, multidimensional, multifaceted problems with a multitude of stakeholders and skills and social stakeholders, thinking that we can solve everything from the lab. We do what we can. I think that we have to be realistic and humble in that sense. So, yes, when we launch projects, we make sure that they reach young people from all backgrounds. I think this issue, especially in Madrid, where you're raising the youth in an urban perspective, needs to be considered first. What's happening in those neighborhoods that makes them disadvantaged? We don't just work with young people, but perhaps women, children, adolescents. Here in Aragon, childhood and adolescence matters are highly developed. The whole issue of local councils, even district councils here in Zaragoza, is fundamental. The big challenge for me is to articulate the networks of people who are already working, to have great respect for those who have been involved in social work, social education, second chance school work for decades, and a lot of projects by people who are already working in neighborhoods, especially with adolescents and young people, who are groups more susceptible to any problem, right? I did want to tell you about an initiative I haven't stated before. We have been supporting a very magical initiative a few years ago in Huesca, working class neighborhood, Perpetuo Socorro. We supported through the Aragon Lab an initiative called Barrio Lab to work on the whole identity issue of our neighborhood, intergenerational activities, activities with young people, which was organized around libraries, the neighborhood library, and which are very interesting spaces. I mean, libraries, in fact, here in Aragon, if there's an active librarian in a town, it becomes kind of a social cultural center. And in the neighborhood, same thing, right? So that project was very enlightening. It generated many wonderful initiatives. They are independent, of course, and the whole network of libraries linked to working with the youth and adolescents is fascinating as an idea that we are launching. Very well, Jesus Maria Pia, if you'd like a little bit about the urban theme and neighborhoods and also about THIVIC's experience with unwanted loneliness among the youth population, would you like to intervene? Great, yeah. I was taking notes. Let's see, I think Madrid identifies with this problem, which also arises as an issue within the workshops we carry out, is because Madrid is very large, complex, and it has more disadvantaged neighborhoods and areas. We have an imbalance or a need for territorial rebalancing. What does this mean? As you say, it's not just for young people, but in general, more limited access to resources, perhaps fewer opportunities for career development, social mobility. And of course, we work with all collectives. We also believe in full public-private collaboration, hand in hand with the associative fabric, right? With all those community assets, everyone, not just the General Directorate of Citizen Participation, but others who are also present, participating there. We co-create and we propose joint solutions. Why do we talk at THIVIC about youth groups in disadvantaged neighborhoods? First, because we need to be more specific in order to delve deeper into a social innovation lab. As we've said, this is unmanageable. Either we reduce the group or, even then it seems too generic, too broad. We would have to cover too many things. It's too cross-sectional. It covers so much. We are especially concerned, though, about young people. Why? Because ultimately, phenomena like school dropouts, disconnection from the system, unemployment can perpetuate this situation with more intensity. Hey, we could have chosen, in fact, we have another topic, that of the elderly, women, vulnerable groups, everything. To the extent that we can, we will focus on it and address it at THIVIC. Our solution needs to come, as in many other cases, with other actors and alliances. There's no single solution. We're already addressing measures, but we need to go deeper and seek synergies, even within the city council itself, from social services, community outreach, educational support, job training, community health, everything related to addiction prevention, urban regeneration, a social and health approach. The environment you live in is key. It creates opportunities, healthy spaces, spaces where the youth can feel at ease. I could talk about so many things, but at THIVIC, the meeting with the young people was also crucial, right? In the end, all these policies will have to be made not only from what those of us who are older think, but also how they perceive it. The workshops with the youth were very interesting because ultimately they said that what they expected was safe spaces. They were looking for innovation, but also protection, closeness, presence, face-to-face issues, development of skills, a lot of ideas. And at the end of the day, to conclude, I'd advocate for two things: for public-private collaboration and also a much more intense and close dialogue with young people, which I think that administrations are not yet there. We tend to distance ourselves, even though we believe we are close to young people, we are still quite far away. Wonderful, Maria Pia. Thank you very much. Diana, I don't know if from NovaGob you've also addressed any project related to youth groups. Yes. In fact, I was really looking forward to getting involved. Although Loredana introduced it at the beginning, we are currently working on a project called Lab Vivienda, which I'm leading now with a team of young people. To introduce it briefly, right? And in relation with what Maria Pia has just mentioned, the importance of giving young people the leading role, right? That's the great innovation of our project, the fact that young people, not only are they listened to, but ultimately the research team is made up of young people. They are the ones who have put the issues on the table and the ones who have focused on the different themes and designated them. We've worked hard on the problem tree mapping of stakeholders. They are involved in workshops that will be taking place very soon. So, in the end, I think that the most important thing when we talk about the most vulnerable groups, regardless of whether we were just discussing right there, whether we are focusing on older people, the digital divide, the social divide, one of the great challenges and concerns for us is always to involve all stakeholders, especially the most vulnerable and those that are more susceptible to inequality. As Maria Pia pointed out, in the end, we can't afford to leave anyone behind. And also, somewhat related to what Eugenia mentioned, which I really liked, the process of engaging with citizens. We have to use that collective intelligence to generate new solutions that are different from the ones that we already know. And for that, it's essential to experiment, to try things out and make mistakes. There are no good or bad ideas. We have to create a space to listen to everyone so that we can build. Ultimately, our goal at NovaGob is to generate additional input that's actually useful, right? An exercise of direct participation where we'll give young people that voice and that role, and that will be useful for public decision makers. In other words, the exercise of democracy is necessary in itself, and what we promote and what we are trying to do here is to make it useful to design public housing policies of the future, right? So that we all have access to decent housing and address the problem of job insecurity, especially among the youth. These are different challenges that we are trying to tackle so that after this exploratory framework we have created, describing possible measures of all kinds, also focused on European models, young people themselves can tell us what measures they think will help solve the problem. So, with all of this, and I'll conclude so as not to be too long winded, the most important thing that we have identified is that this is a multidisciplinary subject and problem. When we are talking about housing, it doesn't just impact at state level our population. Housing is not only the responsibility of the Ministry of Housing, but the Ministry of Demographic Challenges, Labor, Finance. There is an interlinkage of issues, and we cannot address housing without taking into account the Ministry of Youth, the Department of Youth. There are a number of actors that need to be considered and at different levels, state, regional, and local. In the area of housing, the local level is crucial because it has jurisdiction over urban planning and a host of other areas. And that's why we at the laboratory, we work closely with the various municipalities that are part of the lab. The important thing is that we have just completed the first phase of analysis and research, and right now we are in the stage of co-creation so that this can be useful in the end. So, well, that's a little bit of what we are doing at NovaGob, and now we are super committed to this lab, which ultimately is designed by and for young people. Thank you very much, Diana. Bernardo, maybe from Living Lab in Comillas, I don't know if because of the proximity or because of your relationship with the young people, I don't know, have you also reflected on this? Yes, of course, of course. And what impresses me the most is how beautiful this conversation is, isn't it? Because in the end, I feel that these alliances Maria Pia was mentioning are absolutely necessary. In particular, I think that we from the Department of Education and others, we are close to social agents who are, in a way, the eyes, the ears, the hearts who are there feeling the reality of these young people in some of the most disadvantaged neighborhoods. And so for us, they are extremely important allies because sometimes they can live and they do experience the tragedies of today's youth, and they do so firsthand. For our part, it's simply about continuing to form these alliances and meeting spaces and collaborations to better comprehend the question posed by Aragon. What's happening in these neighborhoods? Let social agents and the perspectives of young people, let everything come together to then move certain initiatives forward. And not, as I perhaps think is the challenge for Comillas, right? Also always focused on one department. No, actually, we should act cross-sectionally. We know that these are topics that touch on different areas of knowledge. Very well, Bernardo. Thank you very much. From the HIS, have you had the opportunity to work in this direction, or are you planning on doing so? We've worked indirectly on it. You see, just like with aging, through the themes we've worked on and the way we've addressed the challenges to create the calls for proposals, that's where this group of young people in general has come in. And the truth is that we were very surprised when we started the research phase to define the first challenge. When you speak, everybody agrees, yes, we're going to do a challenge about unwanted loneliness because it's going to integrate, right? It seems that the social and healthcare aspects are going to converge, and it fits very well with this idea of integrated care. So we started doing research and realized that the group that is most affected by unwanted loneliness are not the elderly. The highest peak of the curve was teenagers between 16 to 24 years of age with a completely different typology, different conditions that lead them to feel lonely in one case or the other. There were often young people, and I think specifically at THIVIC, you've delved deeper into the topic of unwanted loneliness in young people. You've probably seen it. But in many cases, these young people are not only lonely due to isolation, but despite spending a lot of time in community, they feel a lack of understanding, lack of shared values, lack of understanding by their peers. So loneliness must be worked on in a different way. That's where the first challenge. We created an interesting project called Zona Mood. It was a project where we wanted to try the teenage level to prevent the feeling of loneliness. They worked at 5th grade level in a very collaborative manner with the participation of the school, primary care, teachers, tutors, the school psychologist, and also the families and the students themselves. Joan, what's happening to me? Can you hear me? Yes, we can hear you, no problem. Oh, my screen has disappeared. I can't see you, and I thought, oh my God. My screen's black. Let's see. If I'm the one who left, I didn't touch anything. It's an innovative element, right? Anyway, as I was saying, in this project I'm telling you about, it was also fascinating to see that within the schools themselves, the 5th grade students had a role model who was that of the high school students doing their A-levels. In other words, they had an influencer or a person they could share with, speak their language, who understood the things they might be experiencing. And it was fascinating. It promoted early detection of unwanted loneliness in young people. It was fascinating. Without directly addressing the group, we have encountered this collective through our calls for proposals. In the second realm, we also have 2 very interesting projects, Resilient, and the other called Guanau. Both are very focused on a vulnerable environment, and we found them not because we were actively seeking them out, because there's a big difference, I think, between what you do. You launch actions, performances, and collectives directly, but we launch themes for calls for proposals, and the collective reaches us through that theme. There's a different approach, right? We haven't done any action aimed at young people, but these young people have reached us through the project themes. So for the second call, as I was saying, there are two projects with this complexity of families and groups of very vulnerable young people, right? One hour is for the childhood. It counsels families so that children, instead of living under protection of a tutor, they can continue living with the support of their families in a family with a very close psychological support. Groups they consider their close family could be a neighbor, an aunt, I don't know, someone who lives further away, but who coincides at some point who they decide is their close family, right? And the Resilientes project is aimed at helping young people who have left care, institutional care, cope with all the trauma they've experienced so that they can focus more on real life and prepare them better so that they can have a meaningful life where they can find work and overcome all their trauma, their fears, and they do so using a 360-degree immersive room technology with an educator and a psychologist working on the content and demonstrating situations they've experienced. Together, they evaluate them and make an interpretation, and it's fascinating. Furthermore, in this project, the participating teenagers themselves have the opportunity not only to see and experience these situations in an immersive room, but also to create their own realities, which they can share with other teenagers. We've also had the chance to see families where a teenager has recorded a video and recreated their daily lives with their families and the difficulties they face. So it's a super interesting project. I don't want to go on any longer because these are projects that, honestly, when I explain them, I get goosebumps because images of the things I've seen come to me and come to mind, and they move me, obviously. Without being directly focused on this group, we have treated them, we are working with them. I think something you said, Maria Pia, is incredibly important, and it's dialogue. We think that we talk and consider the youth. Diana was also speaking about the youth. Jesus too, right? They must be at the center. They must be the protagonists. We can't create things for them without them. It's crystal clear that we don't quite understand them. Maria Pia mentioned a closer and more intense dialogue. An image came to me. There's a Netflix series that you've probably all seen. It's called Adolescence. If you haven't seen it, those of you who are working with these groups, please watch it. It's fascinating. There's a moment when, I'm not going to explain it in case somebody hasn't watched it. I don't want to give away any spoilers, but there's a moment where there's an interview between the police and teenagers, and it's incredibly curious how the police are interpreting facts that have nothing to do with it because they don't even understand when checking their emails, their WhatsApp messages, communication, social networks. They are interpreting a reality that isn't real. And it's thanks to another teenager explaining, hey, this means A means B, B means C, and therefore the interpretation you are making is completely wrong. So when you mentioned it, Maria Pia, that flashback came to me, and it seems fundamental, I would say, key to deal with these groups of young people, right, that are deprioritized, vulnerable, from more working class neighborhoods with more difficulties. Let's give them that space for dialogue and protagonism. I'm convinced that when you put people in front of you and ask them what they want and you speak their language and go down to their level, we often tend to think that they need to be at our level. We want them to understand us. I think this is something that happens in both groups. When we talk to older people, we also infantilize them, don't we? There's a point in speaking to them differently. We have to listen to them and we have to adapt and listen to young people when appropriate or to older people when appropriate, because in both cases, they will contribute greatly to defining these co-creations processes we want, and we want them to be participatory. I'll keep quiet now, right? Now, the truth is, we could go on listening to you. Thank you so much. Let's close this session. We're going over time. Sorry, Jesus. I just wanted to comment on what Diana was saying about carefully selecting the right profiles. We have so much experience in citizen participation. We are clear that the stakeholder map is crucial in any participatory process for setting up a lab. To a large extent, the stakeholder map is key. It's who you invite. And we've always been dragging along the dilemma between the participation of citizens who are formally structured in associations, entities, and unorganized citizens, right? Among them, young people. I think this is an element that we must bear in mind because the new ways, new languages, the different expectations of the youth who are organized and those who are not must be kept in mind when setting up any initiative, participatory process, or whatever. And often those most interested in participating are at the square, at the bowling alley, or I don't know, they're at the club, at a bar, or somewhere else. And perhaps this motivational work based on their languages would be interesting. Even social media, using them in a participatory manner. Everything digital, right? I don't know. This has come to mind while also talking, of course, about respecting and attracting organized groups. Definitely. And another second thing I wanted to mention as a major risk, at least we technicians and public officials face this, is that we often have to mobilize projects, labs, processes, etc. But when there are contradictions in the narrative and contradictions in practice from a public policy perspective, so the youth councils are dismantled. Just an example, I don't know. And on the other hand, we have to implement something else, something changes, and we often find ourselves with these contradictions in our work. We have to be creative and innovative to see how to navigate and articulate things for the benefit of people who we are actually working for. This is my reflection. Thank you very much, Jesus. To conclude, I'd like to let you know that in the surveys we have launched for the rest of the people listening to us today to participate, the comments have been quite aligned with the contributions you've made. A focus on caring for collectives, support, education, training, capacity building, listening to them and understanding from their perspective what their challenges are and how to address them, right? And how for them effective solutions could be proposed that are actually meaningful. That's all for today then. We'll surely see you again on the path of social innovation. Once again, thank you so much. Everything you've told us has been very insightful and relevant. We've already introduced ourselves a bit to each other, haven't we? And we'll surely continue working together and collaborating. Thank you very much. Have a great day and a great afternoon. Thank you all. Thank you so much. See you later. Thank you. Take care.
Gracias.